A lot of people are stressed these days. Stop me if you've heard that before, but more and more Americans are reporting increased levels of stress and anxiety. A recent study showed factors like the economy, global uncertainty, even the Russian-Ukraine war are weighing on people's minds. And this is after COVID. So how can you release or relieve all that stress, and what happens if you don't? Joining us this morning, once again, Dr. Frank Contacessa, to talk about stress. And Dr. Frank, you are using the word insidious to talk about how it can sort of physically manifest in people, and I love it. I think that's the perfect word for it. Why don't you start by talking about sort of those physical signs of stress that pop up in people that you see in your patients?
Sure, and good morning, Tim, and thanks for having me on. You know, it's been such a tough couple of years that Americans have been going through, and the things you just mentioned, the pandemic, inflation, gas prices, it's a constant strain on us. And, you know, we're sort of not designed for it. There's something called, fight or flight response, and we have this sort of cortisol response that when we're under stress, the body releases these hormones, and it's really not the best thing for us. In the short term, it's okay. It helps us fight. It helps us run away. But in the long term, it can have a lot of effects on our health. And the word insidious is great because it kind of sneaks up on you. It's not a sudden thing where, all of a sudden you realize that you're under strain. It just kind of sneaks up on you. And it can manifest physically. We see in the emergency room, we see chest pain. People think they're having heart attacks. It can mimic heart attacks. It can mimic asthma, trouble breathing, sweating, all the things that would send people to the emergency room, gastrointestinal complaints, stomach aches, diarrhea. There's something called irritable bowel disease, where stress brings on either going to the bathroom too much or not enough. So there's all these sort of overlaps between mental health and physical health. And a lot of people don't realize that. And another problem is that it's tough to get mental health care these days. I'm an internist, I'm a general practitioner, so I'm the guy you come to for your yearly physical when you have a sore throat. I'm doing a lot more psych these days because people either can't get in to see a psychiatrist because their schedules are overblown or because their insurance companies don't pay for it. So I become a quasi-psychiatrist, so I deal with a lot of this stuff, and people really need to know where to go for help.
Are you seeing any specific patterns these days in your patients, increases, decreases?
I think the pattern is just an overall increase. People come in and they're still stressed out about COVID. They're still hyper vigilant on the COVID scale, and they're wearing masks alone in their own cars. It's time to kind of get past this. The pattern is just an overall increase, Tim.
Right, and that certainly makes a lot of sense. And like you said, the stress can linger even after the stressors go away for a while. Now, what do you think is a triggering point for people? Obviously, we all have stress. There are certain ways we can cope with it. But before we talk about ways to cope, what can people do to say, all right, this is the moment that I need to go see my general physician?
Sure. Well, first thing, people need to understand there's a difference between stress and anxiety. Stress is what the world throws at you. Anxiety is how you respond to it, and they're not always proportional. You can have maximum stress and no anxiety, or not a lot of stress but feel very anxious about it. So there's sort of a disconnect between actual stress and anxiety. They can be proportional, but they're not always. And I think there's a point when it's starting to affect your health and you are in this hypervigilant state. You can't focus on your work. It's affecting relationships with your loved ones and your friends. That's when you start to seek help. And a good place to start is with your internist, because at least he or she can start you along the path towards maybe talking to a therapist, maybe getting you to somebody who can provide you with help, and maybe even starting you on a medication. That's not our first response. We don't always throw drugs at people, but it's a place to start to at least begin to address the problem. And another great thing, one of the best stress relievers there is exercise. Exercise produces an endorphin rush. The chemicals of the endorphin rush hit the same receptors as a lot of the drugs that we prescribe. So that's a great place to start. Get out and go for a walk. Get to the gym, because truthfully, that's my drug. I work out almost every day, and I don't do it to stay in shape. I do it more as a therapy.
Yes, right. Well, if your mind can affect your body, that seems like that's sort of reversing it in a good way, having your body affect your mind in a very positive way.
Very true, Tim.
Right. Dr. Frank, thank you so much for taking the time to join us to talk about stress. It's certainly a problem we are all dealing with. Thank you.